And we are going 3, 2, and 1. Hi, this is Ray Horner from the Rubber City Radio Group, and we'd like to welcome you to our COVID-19 seminar slash webinar. And we've been graced with an excellent panel today to really look at COVID-19 from the start to where we are and to what might be happening on down the road. I'd like to introduce our panel. So each one of the panelists, when I mention your name, if you want to put your hand up for our viewers here from Summit County Health Department, we've got Commissioner Donna Skota on board with us. From Summa Health System, we got Dr. Thomas Feil, Doctor of Infectious Disease, and Dr. David Custodio, President of the Akron Summa campus. From Cleveland Clinic Akron General, Dr. Terry Lash Ritter, Chief Medical Officer, Dr. Donald Dumford, Infectious Disease Doctor, and also from Akron Children's Hospital, President Grace Rakulchik, and also Dr. Rob McGregor, Chief Medical Officer, on board with us. Our seminar is brought to you by Stark State College, Portage Path Behavioral Health, and Summit County Executive Ilene Shapiro. Donna, if you don't mind, I'd like to start with you, because certainly we've had some news come up in the last 48 hours pertaining to the virus, super spread. Unfortunately, we're seeing a lot of deaths happening across the country. And then there's concerns about the virus and the vaccine of where we are. Why don't you take us to where we are in January of 2021?
Okay. And I'll try to be succinct and as brief as I can, Ray. Thank you for this opportunity today. I think it's a great, just for the whole entire community to hear from all of us exactly what they need to know. But, you know, it's been a journey. We started out with almost 10 months ago now, 10, 11 months ago, where we had it was a lot of unknowns. There are still some unknowns. We know a whole lot more today than we did then. I can tell you it started out with short testing supplies. It started out with any number of mixed guidance to some extent, just because it was a new virus. We told folks first wear a mask, then don't wear a mask. So I think initially it started out kind of chaotic. And then we weren't really sure how the virus was going to behave. And then you fast forward over the time period, you know, we had a spike. After every holiday, we saw a spike in cases because of the community spread. We saw community spread increasing. We saw some testing increase. However, we saw contact tracing increase. However, where we ended up was we had a law in the summer, and then look out. You know, it started to come back with, as we had been warned by many experts, there was a vengeance. I mean, it came back with a vengeance in the fall. And after the holidays particularly, we have seen huge increases in cases, huge community spread. We are now in a situation where we have asked individuals to please stay at home, wear a mask, you know, socially distance and isolate, wash your hands, all of those things we know that work. But now we have a vaccine on the front. And we have, hopefully within the near future, we'll have more than one vaccine. And hopefully we will be able to vaccinate individuals as quickly as this can be communicated and distributed in the communities. Now, the point I want to make here, this has been a journey, but you have to remember, anytime you have a novel virus that shows up, it's going to be a journey. And then when you have one that is worldwide, that impacted everything from the availability of swabs to lab reagents to individuals, you know, and every country handles it differently. And within this country, you know, we've done many strategies. However, we still are in the same position. It will take every single one of us right now getting educated, which we're doing right now, deciding whether or not that vaccine's right for you. And I would say it should be, unless you have some extraordinary conditions. And I would also say you need to continue to practice all of those strategies that we know work. And that's kind of where we're at today, Ray. We don't get a get out of jail card just because a vaccine was developed. We still need to hold the line.
David, let's go in your direction. And with what Donna had to say there, how has Summa Health System prepared for what we are seeing as this winter surge?
Well, first, nice summary, Donna. I think that was very accurate. And, you know, I look back at the early stages where we were seeing those initial models and concerned about that huge surge that was coming. And thankfully, we were pretty swift about all measures that we needed to do to try and curb that here in this state. And we were fortunate that we didn't see that initial surge that many of our colleagues around the country and around the world saw. And we're able to weather the storm. The other issues that we had early on were the PPE concerns, and we had to be very creative in how we could either get those or maintain those or extend the life of those as we were doing that. But the early surge or the smaller surge, as we'll say, in March and April, allowed us to prepare for a lot of the upcoming stuff that then ultimately occurred with the, as Donna put it, coming back with a vengeance. And a lot of the plans that we put into place at the time of the spring really helped us as we're moving into this. We're still concerned, and obviously the volumes that are coming through it's very much significant in stretching the limits of all of us, for whether it's ICU capacity or otherwise. But I think that the preview of coming attractions that we had in the spring helped us significantly as we prepared for this effort.
Terry, let me go in your direction here. There was a lot of people after Thanksgiving that were looking at numbers and saying, well, was there a big overflow from gatherings from the Thanksgiving holiday? And I remember talking with Donna after Thanksgiving, and she stressed, hey, the holiday season with Christmas is coming upon us. And now we are seeing that winter surge, or I should say the holiday surge, here in this month of January. How about over at Cleveland Clinic Akron General? Talk about the plans that you've had to put in place.
Yeah, we have had a very similar experience to what Dave had mentioned at SUMA, and we've definitely been busy. We saw a drastic increase in our number of COVID patients over the course of the month of November, and continue to kind of see the ups and downs, but have stayed at that high level essentially since that time. And so the plans that we had made really honestly from back early in 2020, very early in 2020, the first second that you heard anything even overseas about this novel virus, you had to start thinking and planning and trying to get ahead of it. So, you know, how do we best dedicate our spaces, our staff? How do we make sure that we have flexibility in our staffing to take care of all kinds of patients? And how do we make sure that we're not only taking care of COVID patients, but all the patients that need care in our community? And so we've done that through just daily planning, flexing, and you know, constant monitoring of supplies, from ventilators to prepackaged food and everything in between. So really, that's been a similar experience here in Akron General, and I think that every step of the way, keeping in touch with and working with the other health systems in our community, as well as the health department and the Ohio Department of Health, has really been just a real key to the success that we've had as a community in dealing with this virus.
Grace, I want to bring you in now. It's a similar fight. It's the same fight against COVID-19, but a little bit different, because so many people at the beginning of the fight against this coronavirus said, hey, don't worry about the children. Everything's going to be okay. They don't get it as bad. Well, we have seen that that's not true. Talk about Akron Children's perspective with this, Grace.
Oh, thank you. And I would like to thank my colleagues on the line. I think without the work that they have done, Donna in the health department, all the clinicians and staff at SUMA and at Akron General, Cleveland Clinic Akron General, they have done a fabulous job in working with our community to control this outbreak. What we've seen in children actually started out pretty slow in terms of having just one or two inpatients. Now we are seeing, as this disease has progressed and spread throughout the community, we are seeing a higher numbers of pediatric inpatients with the coronavirus. So I think we have 12 today, and we are seeing many of those kids much sicker than they were originally in the beginning of the outbreak. And so many of those are in ICU, and it seems to be impacting many of our chronically ill children more to the extent than our generally well children that we see in the community. Most likely what we see are children who come in for elective procedures who are tested, may test positive, and the families and they don't even know that they've tested, that they were carrying the disease or had the disease. But it is much worse than it is. But that said, we are looking at nothing like our adult partners are in terms of their capacity issues in general care, ICU, ventilators, etc. Our staff has done a really nice job in trying to make sure that we can help them out if we're needed. We've gone through simulations. Our staff have simulated taking care of adults up to 35 or so and have our space allocated. So, but I think we've only taken one adult patient so far, but we stand ready to help and ready to help with what we can do as far as vaccine distribution as well.
Let's continue to talk about Children's Hospital. Dr. McGregor, why don't you join the conversation and talk about the treatment of the children, unfortunately, that we've seen come into Akron Children's Hospital, because really I want to educate everyone that is taking in this platform that this is serious for all age groups.
Well, thanks, Ray. And as Grace said, the first round we got off easy. We were anticipating having to help out our adult colleagues, but as Dave said, we flattened that curve the first round. And the second time we've only taken one adult that was an overflow when a time when all the adult hospitals were pretty full. And what we've seen remarkably as the community surge or the community prevalence has been elevated is a multiple number of kids with the multiple inflammatory syndrome of childhood. We didn't see any of that the first round. And I think it really reflects the fact that when the incidence is higher, we get to see the rare complications more often. Last week of our inpatients, about half of them had the MISC, and those children are really sick, multiple systems disease. Many of them required ECMO, which is kind of like bypass temporarily to allow these kids to recover. They had terrible cardiac output. And the treatment for that is really very similar to a disease that was kind of just being uncovered when I was training, and that was Kawasaki disease. So the treatment really is modulating the immune system. So giving the IVIG, IV immune globulin to those patients. We also sometimes give them aspirin and steroids as part of the treatment for that. But in extremis, or the sickest kids we've had, did require that extracorporeal membrane oxygenation, ECMO. And fortunately, we have not had any child die from the MISC, but that's not been true of our OCHA colleagues, Children's Hospital Association across Ohio, or our national colleagues.
I was looking back at my notes in doing the radio show. I think I did my first interview talking about the coronavirus. I looked at my notes from 2020, and it was January 25th. I did an interview with someone from CBS News who was talking about this virus that was opening up in China. And here we are a year later and still talking about the virus. And I think we will be for a lot of 2021, and things have changed. A lot of 2020, Dr. Thomas File was joining me about every other week talking about this infectious virus that has been out there. We've learned so much. And Dr. File, and I'm going to bring in Dr. Dunford here in a moment as well. Let's talk about the origin of this coronavirus. There's been stories here and there. Maybe we know a little bit more now than we did back in the spring of 2020, but talk to us about the origin of this virus.
Well, I'll be happy to, Ray. But first of all, let me just, like the others have said, I thank you for doing this, and I appreciate the invitation to participate in this, because I think it's really important. The more information we all have, the better we can make decisions. But this was actually identified, at least the syndrome was identified a year ago December there in Wuhan, China. If you recall, the initial thought was that this virus, which was actually identified and sequenced early in January of last year, was thought to have been transmitted from these meat markets in Wuhan. And really, initially, we didn't even think it was person-to-person transmitted. We thought it was of association with these meat markets. But if you go back and look at the sequences of this virus and the fact that it is a coronavirus, other coronaviruses that we see, both the endemic coronaviruses, which can cause, the common cold-like illness, and some of the other novel coronaviruses that we've seen over the last 2 decades, the one that called SARS in 2003, and then MERS, that was about 10 years ago, they tend to evolve from animal viruses, and mainly bats. But now it's thought that the origin of this virus was from bats and may have gone through a secondary animal called a pangolin, which if you look that up on the internet, it sort of looks like an armadillo, but it is a animal that was sold at these meat markets in China. And so that's probably the evolution, that this is a virus that evolved from animals that then went into humans. And that's fairly common amongst a lot of these zoonotic infections. By zoonotic, I mean viruses or infections that originate in animals, then can evolve so that they can be transmitted to humans.
Dr. Dunford, when we first were aware of the virus, we were saying touch, sanitizer, all that such. The airborne was also there, but we were really concerned about sanitizing, washing our hands and such. And then the airborne side of this story came in as we learned more and more. Talk about the spread.
Well, thanks for having me, Ray. So, I would agree. Initially, we were so focused on touch, and I think, everybody was worried about all the surfaces we're coming in contact with. We've really found now that the touch and contact surface or contacting surfaces that are contaminated is really a minute part of the spread. So this is predominantly respiratory droplet, similar to, say, influenza. Then there's the concern, though, that about sort of on the spectrum of respiratory illnesses between droplet versus airborne, which everybody's probably heard that now, where you're worried about small particles of virus and very tiny droplets of water being able to stay suspended in the air. Now, we still think that that's still not the greatest part of the transmission. We think it's mostly the larger droplets that are going out, and then, sort of going, around 3 to 6 feet, then dropping into the floor. And that's where most of it is, where it's that close contact. However, there's sort of these super spreader events that are probably the aerosol generation, where you've got them hanging in there and floating. And say, for instance, in that good example from the choir, having tens of people being exposed from one person. I can't remember in that scenario exactly what the full number of eventual infections was from that one person, but those super spreader events where somebody's yelling, singing, something like that, where you're spreading these very small particles that remain suspended.
With us with our COVID-19 seminar, again, I'd like to reintroduce our panel. With us, Donna Skoda, the Commissioner of the Summit County Health Department. From SUMA Health Department, we have Dr. Thomas File and Dr. David Custodio. From Cleveland Clinic, Akron General, Dr. Terry Lash Ritter and Dr. Donald Dunford. And also from Akron Children's Hospital, President Grace Rakulchik and Dr. Rob McGregor. Our seminar brought to you by Stark State College, Portage Path Behavioral Health, Summit County Executive Ilene Shapiro. Donna, back to you. I got 3 questions in the last couple of weeks talking about this super spread that we're now seeing in January of 2021 and the amount of deaths and such. And there are some people that are having questions about, are the masks working as far as us wearing these masks everywhere we go? Take it from there, Donna. Unmute yourself, Donna.
I'm sorry, Ray. Thank you.
Okay.
I was trying to not make sure we didn't have any loud noises. I would tell you, yes, masks work. Are they 150% effective? Probably not, but nothing in life is. It is your best shot at protecting yourself from others and others from you. And the more you can wear a mask, the better, regardless of where you're at. Certainly when you're in a medical setting, there is a level of PPE that is required that protects healthcare workers. But just because it's not top of the line, N95 with a face shield and a PAPR on doesn't mean that you're not getting protection. But I want to remind folks, PPE can give you a false sense of, when those masks, when you're wearing it, can give you a false sense of security. You still need to wash your hands. I always see people wearing gloves and then touching their hands with the gloves. The gloves don't do you any good. You need to take off those dang gloves and wash your hands. And you really need to make sure that even though you have a mask on, you stay away from people. You heard Dr. Dunford say, we think it travels 3 to 6 feet. Who knows? It could travel 12 feet. You need to stay as far away from people as you can and wear a mask.
Dr. McGregor, as far as children and trying to keep them as healthy as we possibly can, there's still athletics going on. I know a lot of the kids are wearing their mask in athletics, and then when they participate, they will then indeed take the mask off. And there's been some parents that have reached out with some of the questions and they've asked, should they be concerned as far as athletics and the spread of this virus for their kids participating?
Well, what we've seen, Ray, is there is mild concern, but for the kids while they're playing. Probably the larger concern we've seen is the extracurricular activity that follows the game, because what we've seen is really disproportionately the 16, 17, and 18-year-olds, and we know that those young folks have a little more latitude when they're mobile, when their driver's license. So again, the good news is kids that get infected aren't all that sick. The bad news is they may not even be detected and they take that virus home. So, it's a balancing act between getting something normal as part of adolescent development and childhood development versus the public health risk. And clearly, as the community spread increases, all those activities do increase risk.
With activities, there's also education involved. Dr. File, I want to bring you back in here as well when we talk about the vaccine itself. Some of those people that will be able to receive the vaccine in the near future will be teachers and in the education area. And in talking to some teachers, there has been some apprehension about being, among the front end line as far as getting the vaccine because it was done so rapidly. You talked to me about 9-10 months ago and said, Ray, it's not going to be until 2021 at the earliest when they get the vaccine. Some people don't understand the patience that is needed in those regards. Talk about the warp speed, Dr. File, in getting this vaccine distributed and put together. Dr. Fowle, you're muted right now. If you can unmute that would be good.
Yeah, thank you. Actually, Ray, that's a good point. I mean, if you would ask me last March, for example, that, here it is, January 13th, and we've already now inoculated over 10 million Americans with one of these two vaccines, I would have said, boy, that's totally remarkable. And I think it really is that within that time period, now we have two very effective vaccines, both of them with efficacies like 94 to 95%. I mean, that is totally fantastic from the standpoint of efficacy, and they are safe. And why we were able to do this? Well, because there's new technology, and I'm sure many of our listeners or viewers are aware that this new technology is because of the introduction of this mRNA type of platform that's been developed. Now, actually, that's been being evaluated for several years. It's not totally new, but it's the first time we put it in sort of mass vaccines like this. But I want to make it clear that despite the fact that this has been developed very rapidly, it's still all these studies were conducted very carefully using criteria that is of high standards, and so that the conclusions of this, and particularly for safety, is that this is a very safe and very effective vaccine. So I think it's really fortunate that we have this now that it's being distributed.
Dr. Dunford, what do we need as far as taking this vaccine for it to be effective in beating down this virus? Talk about percentages and the amount of people we need. If we don't get enough, I imagine this virus will still be very active.
That's definitely true. If you look at the transmission of this virus, to really be able to stop the spread of the virus, you need about 75 to 80% of people to be immune to it, whether that's through previous infection or through the vaccine, which is how it's going to be for most of us. So really, if you think that it's got to be if it's 95% effective, you need 75 to 80% of people. That means we need probably about 85% of people to get the vaccine. And that's to be able to get back to normal. And that's, I think, really where we want to get. So those are the numbers that we need to get there.
I want to talk a little bit about the medical institutions right now and the additional training that the staffs have had to undertake, and certainly the stress of the staffs during this pandemic. I think we've heard almost everyone on this panel really thank our medical staffs and our frontline workers for working hard and taking care of us. And I guess, David, let's go in your direction here. First of all, talk about the staff, additional training where you had to really pivot a little bit with the training and get them ready to go in a not a long period of time.
Yeah, excellent point, Ray. You know, we all have been prepared in one way or another for certain infectious diseases, you know, whether they're airborne or otherwise, but really in a very quick period of time, we had to ramp up those skill sets. We put together special teams to help training with the donning and doffing of the appropriate materials. But, you know, that being said, what I think some of the folks don't realize is the toll that has been ongoing. Folks may or may not have been directly affected by this, but if you're in the healthcare environment, these folks have been running short-staffed and significantly at high capacities for months. We've been running a marathon since the spring, and the challenge, you know, early on in the spring, we had fewer patients, but we also didn't have any elective procedures or the other med surge patients that we're seeing now. Traditionally, the first 3 months of the year are when the hospitals are full without a pandemic going on. To add those extra 100+ patients on top of that with the staffing needs has been another significant challenge. And the staff has been dealing with this day in and day out, shift after shift, extra shift after shift, with all those stressors, not to mention the fact, the concerns of taking it home to your family, of spreading it, and then dealing with the stress on a day-to-day basis. So I can't thank healthcare workers, frontline workers, all those essential workers enough, and we can't say thank you enough to what they've been doing. And I think that's what you're hearing from those of us in healthcare. Please, we're doing all that we can to take care of you. Please help us by doing what you can to be safe. Wear your mask, wash your hands, practice social distancing, be patient, get vaccinated. It is, I know it sounds like a broken record, but we need to continue to do that and help us take care of you.
Terry, with Cleveland Clinic Akron General, as far as staffing, not to be particular, but have you had to bring more personnel on? Have you planned to have stress relievers? There's economics, there's health, there's staff getting COVID-19. Talk about the complications that you guys have had to endure. That's a side of it sometimes that we talk a little bit about, but maybe not as much as we should.
Sure. So we definitely have looked at all the resources that we have in our caregivers and how can we best use them, and how can we give ourselves a flexible resource in our people who are taking care of patients. So, you know, it really was a shifting of nursing or physicians or advanced practice providers who maybe hadn't been at the bedside for a while, you know, upgrading skills or, you know, refreshing skills, having them do shadowing if they've been away from the bedside for a while, so that we had, as our patient numbers grew, we had additional staff that could take care of ICU patients or be at the bedside nursing wise. Maybe just another set of hands, you know, to help do some things that may not require more in-depth nursing skills or those kind of things. And also on the other side, how do we work with our, you know, EVS staff and our dietary staff to make sure they're protecting themselves? They know the right ways to deliver meals or to clean a room. And so I think everybody got pushed out of their comfort zone. And we basically focused on how to take care of the patients that we had currently, that we predicted we may have, and how do we make sure that we're protecting our caregivers. To support them, we have you know, relaxation stations, places they can go to kind of take down the stress in the middle of their shifts in order to go back and be able to be at their best when they're at the patient bedside. You know, just like everywhere, as cases go up in the community, we've also had cases go up among our caregivers, and we support them at home through, you know, checking in on them, providing meals for them, making sure that we're in touch if they needed a place to stay because they had a high-risk family member. And so every single way that we could possibly support them, we have done. I would also like to say just the amazing heroes that we have working every day in our hospitals in this community and taking care of our patients. So we have tried to extend that appreciation to them as much as we possibly can.
Grace, with Akron Children's Hospital, we talked about it some weeks ago about how certainly open to taking adult patients into Akron Children's Hospital. I don't know how much of that has happened, but I thought maybe you can touch on that a little bit. And also then with that happening, possibly maybe some additional training that is needed for your staff as well.
Sure. Before I get into that, just a little bit more, Ray, I did want to expound a little bit about some of the other remarkable changes that happened with our staff at both, and this happened both at SUMA and at Cleveland Clinic Akron General. And that was we, on a dime, sent, for instance, at Children's, sent 2,500 people home to work from home. So really looking at changing up their working environment. And then there was the challenge of how do you keep, get these folks set up safely at home, but then how do you keep them engaged in the organization so they feel part of the team? So that was one big challenge that we all stepped up to with our staff. And the second one, which was truly remarkable, was the way our providers and our IT staff step in to execute telehealth. So I think you heard Dr. Custodio talk about the fact that, when this first started up, we really cleared the decks in terms of elective surgeries, procedures, visits. And so, but our families still needed care, whether they were adult patients or children. And our providers really stepped up to provide a significant number of telehealth visits to make sure that those adults and children received care that they needed because they might have been too frightened to come into the emergency room with symptoms that they have. And one of our biggest concerns that's been expressed so far is that we're concerned that people who have symptoms that are not related to coronavirus, but maybe those related to stroke or heart attack or cancer symptoms that they need to be attended to, that they feel safe coming into our organizations to get care. And I think that all of our teams, providers and staff, have bent over backwards to try and help families feel comfortable coming in to get the care that they need. That said, I'll get back to the question you really asked, was in terms of what we've done is we've had all of our providers do simulation in terms of ICU care, adult care on the general care units, and we've run through extensive simulations. We've prepared units in terms of creating more to be, have negative airflow. We've continued changed operating rooms to have negative airflow. So we've done a lot of the hands-on training, and really we don't do this in absence of advice from our adult colleagues. They are been very well, very supportive. If we're going to do this, that they would be able to support us in terms of consultation, et cetera. And they've been very thoughtful in terms of identifying what are the correct patients that we would send to Akron Children's. So they're not going to send an 85-year-old who has multiple comorbidities to the children's hospitals. They're going to look at what are the kinds of folks that maybe we just phased out of taking care of within the past, couple of weeks or months. So it's been a great collaborative effort in the region among all of the hospitals and the health department. So kudos to this Akron region.
Dr. McGregor, I'm going to start to get some specific questions as far as healthcare in regards to the fight against COVID-19. And let's start off, first of all, with children or teens who have asthma. Are they high risk, Dr. McGregor?
They certainly are at high risk, Ray. The underlying medical conditions, especially involving the lungs, puts them at higher risk. And also probably the other comorbidity that is the most risk factor, and I think it crosses with my adult colleagues, is obesity. So, and as we know, childhood obesity is epidemic, so that we've seen that play out already in the patients. As Grace said in the beginning, I think we had probably 30 kids cumulatively until about 3 months ago, and now we've had 127 admissions. Again, relative to what these teams are doing in the adult hospitals, my hat's off to them, and I think there are a lot of healthcare heroes. But I think, when you look at what happens in kids, the reality is kids under 2 can't wear masks. It's recommended by the American Academy of Pediatrics not to be masked. Consequently, my primary care docs are my heroes because, they're taking care of hundreds of well children every day that may not be so well, but aren't masked. So that's another variable that we have to contend with as you see toddlers running down the hallway without a mask, and you run away. You want to make sure you have yours on in the right manner. And so early on, that was a big challenge, and we've continued to work on that. And I think what we didn't know, as Donna said, in the front end was stressful, whether you had a COVID patient in front of you or whether you didn't know if you had a COVID patient in front of you. And the other challenge that we've had and continue to have is the capacity for testing. So we still have days where we can't turn around the tests quickly enough to make the decisions that we'd ideally like to make, although we are doing everything in-house now and no longer sending out. So that was another stressful variable for our teams as we got this started.
Donna, Dr. McGregor talked about certain variables that can kind of blend in together, and we're right in the middle of a flu season right now. And one of the questions I had thrown in front of me is, what's the difference between flu and COVID-19? And if I feel symptoms of a flu, should I go get tested? And why don't you tackle that for me?
Yeah, excuse me. What we usually tell folks is that they're very, very difficult to tell apart. So you should not assume if you have a headache or a sniffles that, yes, in fact, I have my usual old head cold. And I'll use myself as an example. I had a terrible cold where I was losing my voice. And I always get that. I get it every year. But this is a different year, okay? Because I wasn't sure. I mean, you don't know. And you have to be extremely careful that you don't spread it to others. So I arranged to have a test done because I'm in the public every day and I work as a public health responder. So I have to work and I keep working. But I wanted to make sure I was doing it safely. And that option isn't always open to everyone, where the test can be more difficult. So we always tell individuals that what you should do is really, if you are not feeling well, first of all, you should not go to work and you should not be around others. You should try to isolate as much as you humanly can, and then can contact your physician. And if you don't have a physician to call, there are the nurse lines. We always refer folks to the hospitals. They have the nurse lines, they have the consultation. You can call the health department. We have resources to help. But the biggest thing we're encouraging is, yes, eventually, and we can help guide you. We have some testing capacity. Particularly, we try to test immediately children in schools and school staff personnel so that we can keep them in school if possible. We also have some available for first responders, employers, congregate settings. So yes, we can try to help. So if you are not feeling well, the first thing, and when I say not feeling well, I mean if you have a headache, if you have, I can't tell you how many people I have talked to, Ray, that have said to me, the only symptom I had was I had a headache. Well, on any given day, considering 2020, all of us could have a headache, and you just don't know. And so I really encourage folks to be very intuitive and to really self-monitor your symptoms. Take your temperature, do whatever, but you really need to be careful.
Donna, what if we've come in contact with someone who has tested positive for COVID-19?
If you come in contact, you're considered a contact with somebody. Again, depending on your exposure. Was it greater than 15 minutes? Were you within 6 feet of circumference? Were you with them in an extended period of time? Even if you are masked, though, however, we do still consider that an exposure, just because it can create spread. So what we always tell individuals, you should quarantine at home because you're still well. If you're an essential person in an employment situation, you are allowed to continue to work in quarantine with a mask, meaning the appropriate level of PPE for your profession. But the minute you start showing symptoms, you should stop. That quarantine period lasts for 14 days. Now, you have probably heard CDC recently said we can shorten quarantine for some folks. I personally believe it's a fool's choice to think 7 days and a test will get you out of quarantine, simply because you may not have a viral load to test positive. We have tested folks on day 7, they're negative, day 9, they're positive. So you have to be very careful, and you shouldn't do that without medical advice. The other thing is, if you are ill and you are placed in isolation, you need to complete your isolation period for those 10 days. So it's difficult for folks to understand the difference. You know, you could actually be sick and get out sooner. You know, you could get sprung sooner than if you were in quarantine. But that's very difficult for folks to understand that you could break with that disease anytime during those 14 days. And so we are very careful to monitor that.
Dr. File, can I get COVID-19 more than one time?
Yes, and it's definitely, I think I'm unmuted. Yeah, definitely that has been documented. The thought is that if you've had natural infection, we don't know what the duration of immunity is going to be, but basically the CDC suggests that it should last at least about 3 months. But after that, it's possible that you could get it again. And that's one of the benefits of this vaccine, is that once we get the vaccine, and particularly the second dose, we get a booster effect. And so we're hoping that the duration of the immunity after that will last much longer than that 3-month period.
In regards to the vaccine, if I get the vaccine, how long before it starts to work in the body? And should I feel good to go out in public once I get the vaccine?
Well, we know that after the first dose, after about 2 weeks, you start to get protection. But it's really after that second dose that you get the good booster effect. And probably maybe 2 weeks after that second dose, you should get your maximal efficacy of the 94 to 95% of not having any disease after that period of time. But that's a good question that you ask. I mean, should you feel safe going into the public without a mask? And the answer is definitely no. Because we do know that some patients may not respond. There may be the 5 to 10%. And also what we don't know, although we know very clearly that the vaccine prevents disease, we're not absolutely sure that the vaccine prevents infection. And by that, I mean asymptomatic infection. And that is something that is really unique with this particular virus, is that a large percentage of patients, and I think Donna alluded to this, but a large percentage of patients who acquire this infection don't get disease, but yet they can transmit it. We think, at least from sort of preliminary indirect evidence from the Moderna study, that the vaccine does reduce the likelihood of this asymptomatic disease period and therefore transmission. But until we have more information, until we have a much greater percentage of the patients that receive this vaccine, like Don mentioned, maybe 85% or whatever, we still have to follow all these mitigation policies and behavior that we've already mentioned, such as the mask, distancing, avoid congregate settings, etc.
Dr. File, if I've had COVID-19 and I've recovered, some people are saying, well, I've had it, I can go out in public now and go and do what I want. Talk about that aspect of what the body has done with antibodies. And, are you free to go out for a period of time or not?
Well, again, that's a good point, and we don't know how long the duration of potential immunity is after a natural infection. So we still need to follow these mitigation policies so that we can reduce transmission throughout the whole community. For example, I just was contacted by one of my colleagues about his daughter who actually had COVID early in September. But then, and this alludes to what Donna was mentioning as well, over the weekend, she went to a party where they were watching the Browns play. And I'm sorry about, I see what you see there, Rob, but anyway, or behind you, but they were watching the party with the Browns and the Steelers, and they were in a closed room. And one of these persons, and obviously I'm sure they were cheering and yelling, so that there was a lot of potential dissemination of aerosols within that room. So, and one of the persons in that room then was positive for COVID. So now it's more than 3 months. So now we still have to consider that she is exposed and potentially at risk for having acquired it again. So now we have to put her back in quarantine.
Wow. Dr. Dunford, step in here. Let's talk about something that I had more than a few questions, and I also had it on my list as well. And that's this word we're hearing now about this variant in regards to COVID-19. We had it pop up. First of all, we were hearing it in the UK, then the Netherlands. Then there was one in Africa that some people were very leery about because of the changes in the virus. As a matter of fact, just down the road in Columbus, as of today, we heard that there was a case of this variant in Columbus. Educate us a little bit on that side of this story.
So these new variants we're seeing, they have a alteration, and probably everybody's heard this point of the spike protein. Essentially, they're able to infect the patient more readily. They found that these people also have higher viral loads, which means that they're more contagious. Actually, from the calculations, we're figuring that at least the UK variant is probably about 3 times more contagious than the other variant that's going around. The variant that the sort of wild type strain that we talk about, so like the baseline strain, you probably infect about 2.5 people for every person that's infected. The UK strain, their thing is actually 7.5 people for every person that's infected, so much more transmissible. Luckily, we haven't seen that either the UK strain or the South Africa strain have been any more virulent, meaning that they're any more likely to cause more serious disease or death. But really, just with the way things are, the more contagious the virus is, the more people that are going to get sick and the more people are going to end up in the hospital. So really, that's concerning us right now. Luckily, at this point, nobody's thought that there's any effect on vaccine effectiveness. Everybody thinks that at this point, these 2 strains are going to be well covered by the vaccines that are out there. But I think just with a more contagious strain, it just reiterates our need to stay safe with social distancing and masking, because that's pretty scary to me to have something that's that much more transmissible.
And Dr. Dunford, in the world of fighting viruses, kind of expected, right?
Oh, definitely. You expect that viruses are going to mutate. Some viruses are more mutagenic than others. Just thinking about in general, with the way things look, every year with the flu, we see some changes in the flu, which is why every year we have new flu vaccines, and people are at risk again. Or you think about something like HIV, which everybody hears about, that's a highly mutagenic virus, and you just see within actually just one person, there's all sorts of different variations. This isn't necessarily a very mutagenic virus, but just thinking about how widespread it is with 90 million cases worldwide, even a small number of mutations can lead to gigantic changes in what's going on. So and heaven forbid that the next thing that comes out is something that's highly transmissible and more aggressive.
And David, that leads me to my next question with you, because I did have some of our listeners send me a question saying, hey, with this variant out there, is the vaccine, and Donald answered that to a degree, is this vaccine, do we still have a lot of confidence that it's going to work against COVID?
Yes, and I'll defer to my ID experts as well, but yes, to this point in time, we do not feel that the vaccine has reduced its efficacy against these variants, and all the more reason for us to encourage that as it becomes more readily available.
Dr. File, in regards to this variant, what degree of change would have to happen where you would be concerned about the vaccine's effectiveness?
Well, right now, and Don already mentioned this, the vaccine and the antibodies we develop because of the vaccine are developed against this spike protein, which is the projection that you see in the models of the virus that come up from the surface. And these projections are the aspect that allows the virus to attach to receptor sites in our cells. And the more that may change, the more that we would be concerned that maybe the vaccine may not work, because the vaccine develops antibodies against that particular part of the virus. And we know with this sort of UK variant that there's several mutations that have occurred in that particular area of the spike protein. On the other hand, the antibodies that are developed after the vaccine actually act at many more antigenic places of that spike protein. So that's why we still think that this vaccine is going to be very effective against that particular variant. And so the concern, and to answer your question, would be if we saw that there were many more mutations, then we have to be concerned. But I also want to sort of reinforce what everybody said. I mean, these are RNA viruses. They tend to mutate, as they go through populations, although they don't mutate as fast as influenza, as Don mentioned. but this is not unexpected. And there's probably a lot more variants that are out there transmitting the community, but that have no clinical consequence at all.
Dr. McGregor, step on in here. Let's talk about flu, COVID-19 still there. A lot of parents want to know what to do if their kid develops some sniffles and maybe a headache and maybe very similar symptoms to the flu. What could you tell those parents?
Well, I think it's interesting because to Donna Scotta's comment earlier about masks do work. Remarkably, at Akron Children's, almost every January, if you looked around, we would have dozens of kids with RSV and dozens of kids with influenza A and B. And to today, we've had 0 patients test positive for RSV or influenza A or B. So right now, if a parent has symptoms and they're saying, oh, this is probably the flu, statistically, it's probably not the flu. So we really need to take it seriously. I dreaded the day where I thought we would have all these co-pathogens, and that's just not been what our virology lab is telling us so far this season. And I do think that reflects, wearing masks. So, we got to be vigilant and just assume that if you've got new symptoms, you need to be evaluated for COVID.
Mhm.
Terry, let's step in here and talk about vaccine rollout. I know the governor had an announcement on Tuesday talking about the rollout. Maybe you should say. Maybe you can educate us a little bit on what you know as far as the vaccine rollout in Ohio.
Sure, happy to. So I think most people are familiar with the tiered system as far as the vaccine rollout, with a recommendation to start vaccinating healthcare providers and our residents and healthcare providers that work in congregate care settings. And so here at Cleveland Clinic Akron General, we are still working our way through our healthcare providers. We are vaccinating many, many healthcare providers, caregivers every single day here, but we do have several days left to go before we can get through all of our caregivers. And so, I'm excited to start to plan to vaccinate the public. I know we're going to start with our most high risk patients in our community, starting with, I think, over age 80 is the recommendation from Governor DeWine. And so we are working with this group here on the panel, as well as others, to look at how we can start into that planning and, where that will happen, how that will happen, where the supply will come from. And so just like everything with this virus, we are kind of planning on the go. And so that's our status here. We're working our way through all of our healthcare providers, our independent physicians out in the community, and looking at starting to vaccinate our public as soon as possible.
Terry, let me ask you this, and again, there's probably a lot of people wondering, okay, when the rollout's here, when can I get the vaccine? Should my listeners start, or should our viewers start by getting a hold of their doctor and maybe getting some advice on where and when to go?
I think that's always a great place to start. I think that our public health departments also are great contacts and have some wonderful information on their website, or if you call their numbers, as far as places to start. But I think talking to your healthcare provider is always a great idea as far as finding out, number one, where will I be in the list of, the tiered system as far as priority? How will I be communicated with when a vaccine becomes available to me? What can I be doing to be proactive in getting on any registries or lists that are out there?
Donna, why don't you jump on and carry on to talk about the vaccine rollout?
Okay. As you know, the governor established those initial 1A group, which was really individuals that lived in long-term care, congregate living, where there was actual workers going in and out. I mean, if you remember early on, most of the deaths that we saw occurred in those congregate living sites. And then you have workers going in and out. We also have a lot of workers who also work in multiple sites. So actually, and then you have contractors that go in there, like physical therapy and OT, and many of those individuals travel around. And we saw quite a bit of death and disability. So the governor established long-term care, congregate living, EMS responders, anybody in that group A that would be of, disability, developmental disability, group homes, ADM, alcohol, drug, mental health, group homes, anywhere there was congregate living, that people could in fact be exposed in the work, excuse me, in their home setting. So with that said, health departments and I believe hospitals were the only two to receive the initial 1A vaccine, and they received either Pfizer or Moderna. We actually received only Moderna, and we began vaccinating. We had all of our EMS, we have done all of our DD group homes, all of our ADM. We are now into our home health, hospice workers, kidney dialysis. We have also done the 2 long-term care facilities that were assigned to us. We were also assigned convents because they are classified as long-term care facilities for the religious orders. And so every day the state may add to our list of folks we're responsible for, but in the next week, we are responsible for all of our non-hospital healthcare providers, which would include, dentists, physicians, family medicine, internal medicine, those folks, and then a pharmacist. And we will move on then from that other non-healthcare providers, which would be individuals like perhaps dermatologists, individuals that are in the community we know that may or may not have direct patient care. We are also responsible in 1A for jail, the correctional facility staff, and then those individuals who live in community correction settings. So it's a journey during this first 1A. And then on the 19th, the governor has indicated that he will use a multifaceted approach to dispense the vaccine. About 30 providers in Summit County, each will get a little bit of vaccine. And when I say a little bit, I mean 100 to 300 doses that they will be able then to vaccinate the 80 and older group. So as Terry said, we work with this group and we're trying to figure out the best way to administer to that group and to make sure, but every week from then on, the age group will drop by 5 years. So on the 19th, we will start with the 80-year-olds, and then on the 26th, we will go to the 75-year-olds, and hopefully we'll have the 1B vaccine will continue to pick up, and we'll have more and more and more vaccine available. At the same time, we're preparing to do the second doses because we're just starting to receive our second dose vaccine for the first folks that we had vaccinated on December 26th. So it'll be very confusing for folks. So we will have stuff on our website. We will have places you can go. We're doing the press conference at 2 o'clock today to announce and talk about where you can go to get this vaccine. So hopefully we'll be able to make it understandable for folks.
I'm Ray Horner, morning host of WA Care Radio. Hopefully you're enjoying this education and informational COVID-19 seminar brought to you by Stark State College, Portage Path Behavioral Health, Summit County Executive Ilene Shapiro. Dr. Dunford, going back to you right now, and Donna talked about the vaccines and the different vaccines. Besides the freezers and the temperature and everything, what's the difference between the vaccines that you know of?
Pretty much it's sort of the same baseline technology. So they're both mRNA viruses, and pretty much then it's just the fillers that help to keep them together and keep them stable. But pretty much the technology itself is relatively the same. So as far as how they work.
And what is that? Without getting too deep in the lab, how does that work?
So if we pretty much with the mRNA, so if you think about it, normally our bodies have DNA, and then from the DNA they send something called the messenger RNA down to pretty much we'll say the protein factory, so the ribosome, and the ribosome makes proteins. So this, instead of going from the virus coming in, then sort of hijacking things and making or then producing its own mRNA, we're just taking small snippets of that small snippets like that mRNA to just trigger the immune system to start to make proteins that look like the spike protein. And instead of like one big spike protein that the virus has, we're taking small little pieces of protein that then the body responds to and makes antibodies to protect ourselves.
Dr. File, word came down a couple days ago that a gorilla at the San Diego Zoo tested positive for COVID-19, and that gets a lot of people concerned about this virus going to animal, flea, tick to humans and such. Going back to the beginning of our conversation, you were talking about the origin of the virus. Maybe a little bit on what you know, and is there a chance that we could get COVID-19 from an animal?
Well, that's a good question. I don't know or we've had any examples where that's actually occurred. I mean, I know that, for example, cats have definitely been shown to be infected. And so there was always the concern that if you're infected, might you transmit it to your pet? What we don't know is the other way around. I mean, would your pet transmit it to you? So I think that's just something that we'll have to follow. And I hope that the gorilla does fine at the zoo.
What about the weather temperatures? I remember going back last spring, there were those that were saying, oh gosh, if we can get to the cold weather, we'll be in better shape. Well, obviously that hasn't happened. Does the weather temperature traditionally affect viruses, and has it affected COVID-19? From my viewpoint, it has not.
Well, respiratory viruses, including influenza, including the coronaviruses, actually they do better in cooler weather and when it's less humid. So in the winter, it is obviously cooler and it's less humid. So the environment is more conducive for the proliferation of the virus in that aspect. And then, of course, there's the issue that when it's cold, you're going to be inside more. You're going to be potentially close to other people within congregate settings in more. So that's going to allow for a greater transmission at a time when the virus is probably more conducive because of the environment anyway.
Dr. McGregor, have we seen any difference in symptoms between adults and children in regards to COVID-19? You're muted right now. If you can unmute.
Sorry about that.
That's okay.
Yeah, we have seen some differences, but more things are the same, at least early on, until they can get an inflammatory response and lung disease. We have not seen quite as many kids, other than people that had underlying lung disease, get significant lung disease requiring the ventilator. But what I have seen, and I understand there's a multiple inflammatory syndrome of adulthood, MISA, that looks a lot like what we're seeing with the MISC. And I think the MISC is interesting with our kids because that's when we find out they had COVID. It's multiple. Sometimes they know they have COVID, and now we're talking 2 to 3 weeks later, they get this significant illness with high fevers and multiple organ systems affected. But many times we have the kids that come in, and last year I would have called a Kawasaki and not even done a COVID test. And this year we do a COVID test or an antibody test, and we say, I'll be darned, this probably fits. And then we've seen that disease be partially obvious to blatantly obvious. And there's been a large spectrum even of those. So again, since I don't take care of the adults, I know that we've not seen in our children, we've not seen COVID, stroke, or some of those things. However, we have become aware of that because we were prepared to take care of some of the adults. And one adult we did take care of exhibited symptoms that we don't classically see in our kids with COVID thus far. But I think my adult colleagues can probably expound on that better.
Grace, what about using Akron Children's Hospital during a COVID-19? If we have a youngster that is sick a little bit, do we bring them through the door? That's one of the questions that I received. Should I be apprehensive? Should I make the call to the doctor, or should I go to Akron Children's Hospital?
I think you can do any one of those three things, just so long as you seek care for your child. So you can start off with a telehealth visit, a nurse call. If your child is really sick, please bring them into the emergency room. We have our providers and our staff have done a wonderful job of instituting precautions to make sure that families are safe and healthy in our organization. And so I would say that if they are worried about their child, they can start by contacting their provider, do telehealth, bring them into the emergency room, go to quick care or a urgent care setting. But please make sure that if you are worried about the health of your child, that you contact and get them the care that they need.
David, do you want to expand a little bit on that from Summa Health Systems perspective?
Sure. To Grace's point, we're seeing similar things. If folks are sick and need attention, they do need to contact their providers and determine the best means of getting taken care of. And if you're sick enough to require the emergency departments and any hospital department, we're doing all that we can to make it safe. We do the social distancing, we space appointments, we do telehealth interspersed, and we do all the appropriate disinfection, and also continue to provide PPE and follow all those similar precautions. One of the concerns and one of the things we saw that I think others have alluded to is the number of folks that were presenting with non-COVID related strokes and heart attacks dramatically dropped off. The preventative care and some of the screening care that needed to be done dropped off, and there are consequences associated with that. So we are very much aware that even though COVID is out there, there are folks that need and continue to need care, whether it be preventative or acute illness care. And we can't stress enough, it's not a reason to stay home. If you need attention, please seek it, whether it's a telehealth, a telephone, or in-person care. We will provide it safely at any of these institutions to make sure
Emergency room visits. Terry, why don't you expand a little bit from Cleveland Clinic, Akron General?
Yeah, I think it was really significant in the spring, the drop that we saw in our emergency department visits, way beyond what you would have thought to be explained by, by people just wanting to quarantine or not, trying to stay safe. People clearly were getting sick at home and not seeking care. And I mean, that was a tragedy unto itself. As we were working to understand and make sure that we were taking care of our COVID patients, there was a whole group of patients in our community who were not seeking care due to fear. So, I would echo Dave's comments around just that it is safe to seek care if you're not feeling well. It is safe to seek care for your preventative care. We want you to still have all of your screening, cancer screening. We want you to have your lipid screening. We want you to have your checkup. That may be virtual right now if that's your comfort level. It may still be to come into the office. Our visitation policies, our policies around PPE are to protect you from being exposed when you come in to seek care. So, I think that when we look back to this kind of season of healthcare, I won't even say 2020, right? Because we know that it's going way beyond that and will continue to be a challenge for our communities and for our healthcare environment. That I think that's what we don't want to have missed is that, we want to take care of all people, all patients. And so, don't let fear be the thing that stops you from seeking care, because, this is a limited time in our lives, hopefully, but, it's not so much that you can just put off your preventive care for a long time. So I would say it's safe to come into any of our healthcare institutions and please seek the care that you need.
Donna, I received a number of questions saying, hey, I'm a smoker. Am I at higher risk? I am a diabetic. Am I at higher risk? In general, can you talk about high risk folks?
Yeah, it's anyone who would have any of those underlying conditions. And I think we have previously talked, obesity, which often maybe we don't think about as such a, we're so, in this country, it's kind of been an accepted norm almost to some extent. But obesity puts you at risk, any sort of lung disease puts you at risk, any sort of underlying health condition for which you're immunocompromised, any sort of chronic disease, cancer patients, anyone who has any sort of health conditions. But I want to really make just maybe a little bit of just anecdotal warning here. We have had plenty of people have COVID and have severe disease that did not have an underlying condition. I want to make that point. And so I often hear folks say to me, oh, I'm a healthy 45-year-old. I don't, I've never smoked. I don't have lung disease. I don't have asthma. I'm good to go. Well, I hope. I've said, that's kind of a risky adventure. We don't know who gets really sick. And I have talked to some really young folks who got really ill and nobody knows why. And I've talked to some really old people who said, oh, I had a headache. So, I mean, I really think you need to be careful here. Underlying conditions certainly put you at greater risk for any sort of illness. However, don't count on that as your get out of jail card, because it may not work for you.
I'm going to circle the panel here in a moment and kind of get some closing comments from all of you on how you view the importance of this education and information for our folks with COVID-19. One final question for you, Donna, and that is a concern that some of our listeners had said they just don't know where to go to get a test, and whether it's a rapid test, a lab test. There's been a lot of confusion according to some of our listeners' questions. Can you attack that for me?
Yeah, I think we get that question all the time. And honestly, you should start with your provider, your medical provider, if you have one, or as I've said, you can call our helpline, and we can tell you about whether or not, a test may or may not be appropriate, or connect you to a healthcare provider. I do believe that's a good place to start, because hopefully they have some sort of medical history with you, and they can give you advice based on knowing you as a person, which I think is always good. However, there's lots of tests out there. And I have to tell you, because this is a novel virus, the state of Ohio, there's an epidemiological definition of whether it's a case or not. So just because you go get an antigen test, and just because you get you have antibodies test, doesn't mean we count that as a case. We have to follow a very strict case definition. And I think individuals get mixed up between the antibodies, the actual having the antigen testing, and then the PCR, the gold standard. And so we try to, educate folks on whether or not and what they need to do if in fact they have one of those test results. But what we have happening, Ray, is we'll have somebody test positive, not like the response, not like the answer, go get a test somewhere else, call us and tell us that they're not a case, but in fact they are a case because they've already been reported to the state of Ohio. The physician also has the ability to make you a presumptive case. If in fact you've been exposed, you have symptoms, they don't have to have that test. They can say you are presumptive COVID because you're living with two people that have COVID. You have a fever, you have a cold, you have a cough. That is a physician's priority. And we welcome that because they're using good clinical judgment to make that call. So there's lots of ways, and that's why I'm saying you have to call us or your medical providers, or the hospitals, like I said, have the nurse lines that are amazingly helpful. You just have to call and get it from a reliable source. I would tell you the internet, Facebook should not be interpreting your test results for you.
Okay, I'm going to circle the panel now. We'll get some closing comments from each one of you. And Grace Rakulczyk, the president of Akron Children's Hospital. Let's start with you. COVID-19 fight here in January of 21.
So thanks for having this forum, Ray. Really appreciate it. I think one of the key messages that when we talk to the CEOs and Donna that we want to convey is that be patient. We have a vaccine. It's here. We're limited by the supply chain, but we do plan to immunize people as fast as we can with what we're supplied with. And we want to do it so that we really take the opportunity to quell this whole problem in our community. But still, please be sure to wear your mask, wash your hands, be socially distant. So, but please be patient. Most of all, we will get to you. Donna has a fabulous team. We have a wonderful group of professionals and providers here who want to make sure that you get well and stay well. So just be patient and we'll get your vaccine to you.
With us, Dr. Terry Lash-Ritter, Chief Medical Officer at Cleveland Clinic, Akron General. Terry, how about you?
I think my final words would just be, we're all tired of this virus, right? Don't let the virus fatigue let you start to not continue to protect yourself and protect the ones that you care about. Just echoing we need to all continue to mask, to physically distance, to clean our hands and protect each other. I think early on in this pandemic, there was a wonderful community feel that came out. I'm staying at home to protect others. And, just like anything that can fatigue over time, but that's still where we're at, even with the vaccine. And to Donna's point, we're going to get that vaccine out as soon as we possibly can, but we need to continue to do those things to protect ourselves and others in our community.
Also, Dr. Dave Custodio, President, Akron Summa Campus. Dave, you?
Not to sound like the broken record, but I agree wholeheartedly. Being patient, whether it's waiting for your vaccine, whether it's being patient with all the things that we have to do to protect ourselves and others, it's more than just about ourselves at this point in time. Even if we aren't high risk, as Donna said, and we think that we may get through this without any significance, you're still transmitting it to folks that can have more severe illness. So please be patient, do the things that we know that work, get vaccinated when it becomes available, and take care of yourselves and others as we move forward into this new year.
Dr. Rob McGregor, Chief Medical Officer, Akron Children's Hospital. Rob?
Well, Ray, I would kind of pile on to what Dr. Lash said, is that, the vaccine is wonderful. It is really the fact that we've got a vaccine available to us in this short a time without having cut corners. They really did. They were able to do that because we did a lot of the work that would normally be done sequentially. We did it in parallel. So it wasn't that steps were skipped. It was really that we cut through some of the red tape and we're able to get this done. That's awesome. And it is a beacon of hope in the distance. However, we can't let our guard down now. So just because I've got the vaccine, I am not invincible. I still may get asymptomatic disease and I may give that to a sick elderly relative. So this is a public health issue, not a political issue. So we really have to believe in the science. Thanks for having this, Ray.
Most certainly. With us also, Doctor of Infectious Disease from Cleveland Clinic, Akron General, Dr. Donald Dumford. Donald?
I think I'm also going to sound like a broken record here, but I think the biggest thing to tell people is that at some point things are going to get back to normal. Pandemics have been around before; they've all ended. We just have to be very patient and very diligent until we can get back to normal. And it's still going to be a while. There's going to be a while till we're able to run around with friends and do things. I'm still waiting to have my 40th birthday party, which was 9 months ago. But things are going to get back to normal. We just have to keep doing what we're doing, make the sacrifices now so that we can keep ourselves safe. We can keep everybody safe around us. You're not, as everybody said, you're not trying to just protect yourself. You're trying to protect your parents. You're trying to protect your grandparents. You're trying to protect your siblings. You're trying to protect your neighbors. We're all in this together, and we all have to keep making sacrifices. Be creative with how you get together with people. Zoom calls are great. Things like that. Just stay apart while being together. Stay apart. Wear your masks. Stay diligent, and we're going to get through this.
Doctor of Infectious Disease at Summa Health System, Dr. Thomas File.
Well, Don, I think you still look 39, so you look great.
Thanks, Tom.
This saves lives.
Yes.
Please do this. Plus, I hope every one of our viewers plans to, when it's available to them, to receive the vaccine. That's the best way we're going to beat this pandemic and keep our economy open and stay safe.
Commissioner, Summit County Health Department, Donna Skota. Donna?
Yeah, I probably am the broken record here. But to be quite honest with you, I would echo what everyone else has said. And I think it's critical that we realize this will not go away unless we do everything that we need to do. This virus requires a behavior change. And as Americans, we really hate behavior change. And I have to tell you, it's outsmarting us. And so we need to wear a mask, stay away from each other, take that vaccine. Because honestly, it is our only path forward. And, Lord forbid, but there could be another one right around the corner. We don't know. We have to practice these behaviors now. We have to get good at them so that we can protect each other. And probably I've been too close to it because I've talked to a lot of the families. I've talked to a lot of people that have died. I've talked to a lot of the survivors. I know a lot of how that spread happened. And I can tell you, a lot of it didn't have to happen. So we need to stay away from each other. That 40th birthday party, I agree with Dr. File, you look 38. You can wait until 40, okay? You can have it in 2 years and I can guarantee you, you'll still look 38, okay? So we need to not rush life but really we have to stay in this together. Wear a mask, wash your hands, and Lord, get that vaccine if you get the chance.
There you go. Words from the experts from Suma Health System, Cleveland Clinic, Akron General, Akron Children's Hospital, Summit County Health Department folks. You heard the words there. Stay the course, be patient, wear the mask, social distancing. I'd like to thank our sponsors, Stark State College, Portage Path Behavioral Health, Summit County Executive Ilene Shapiro, and a big thanks to our panel of experts for taking time, and it is so stressful. You heard in the last 60 plus minutes the stress on our healthcare workers and our health professionals, but they took time to join us here today to educate and give us intel, and it is so much appreciated. That is what makes this Akron community pretty darn special. Ladies and gentlemen, thanks for joining us. We appreciate you joining us on our seminar here with the Rubber City Radio Group.
Thank you.
Thank you.
Thanks, Ray.
Perfect. Thank you.